Welcome back to American Medicine Today. Have you ever heard that sales reps can actually be in the OR?
It's an all behavior. You need to remember that physicians, they need some help sometimes with new devices.
Okay.
And then I remember when I did hip replacements or knee replacements, they offered to us a different type of a product.
Okay.
And then there are two different types of information here. One is why we should have reps in the OR, and the other one is why we shouldn't have reps.
Well, why should we?
I think we should have reps in the OR because the technology is very advanced today. And that reps are individuals that they are very familiar with this instrumentation. For example, sometimes myself, I have tools that they require, for example, to extract one screw inside of the body. And I need to have exactly the instrument to be able to take that out.
Right.
Because if I don't, I will need to take with my teeth. Okay. So the problem with this is how you do it. The reps are very, very, very much trained on this.
Okay.
And then they know exactly what type of a screw is there, and they know exactly what type of instrument that you need to use, a screwdriver you need to use, what adapter to be able to take the screw. The same thing now becomes more and more difficult. For example, the new type of a knee replacement, new type of hip replacement, they need to have certain special cuts, how to minimize the exposure of the bone.
But do you think they really understand the intricacy of the surgery? Because some are being trained to perform surgery and they're not doctors, they're not surgeons.
I understand that, they don't. But you know, what's the difference between that person saying, okay, doctor, you have a screw that is XX1 and this screwdriver is the one indicated for that, and give that thing to the technician goes and give it to the doctor, and the doctor removes the screw, and everything is organized in order, and then they walk out. This is what I think with the more technology and more advances, they are necessary.
Okay.
Now let's go to the other side. Why they shouldn't be there? Well, they shouldn't be there because I really think that technicians that they work in the operating room should be trained, and they shouldn't be somebody coming from the outside who doesn't have knowledge of sterility, who has no knowledge of what the surgeon is doing, or how this is going to impact the patient.
Right.
It has no knowledge of the results of post-operative results or anything like that.
Right.
So a technician in the operating room should be working with that surgeon, and that technician should be educated in that type of procedure with the instrumentation by the company.
Sure.
So what they should do is they send the technicians to a training program to those companies, and then bring those technicians to help the surgeon. But now is an integrated surgical team to do that. That I think is more elegant, and I think is more effective, and I think is more responsible. And the other part of it is why they shouldn't, is because they come over and sell you the product.
That's just what I was about to say. Things like disc replacements and fusion hardware and all those different things, there's really an agenda on their side to push those tools, and it's irrelevant of the fact of whether it's beneficial to the patient.
Yeah, well, remember that these individuals are being highly paid. So when they go there, the concept is very clear. The concept is, I'm going to walk there and I'm going to sell you the product from my company. But then it's in the doctor's common sense to say this product I will advise to the administration to buy it or not.
Sure.
But at the same time, if you start to work with a rep a lot and the product really works well for you and your patients, then probably you are going to say, I recommend this product.
Right. Okay? I just have a feeling some of the time it's a device that's used to speed up what they do, but it's not in benefit of
let me tell you
patient satisfaction.
Let me tell you one thing that is exactly what you're saying. The cost of one screw is around $50. You know how much the hospital pay to maintain stock? Because they need to maintain stock.
Right. How much?
$1,000 for the
For a
same screw.
$50 screw.
Yes. So you pay $1,000. You need to put in that patient, imagine that you put in
Multiple
that patient
screws if it's a multi-level
multiple
fusion.
screws. And when you put 6 screws or 8 screws, it's $8,000 just on screws.
Right.
All right, and then you need to put the tape and the plates, and then you need to put the
So
frame.
basically $800 just in screws, but now you're up to about
$8,000.
$6,000 or $8,000 by the time all the extra fees are tacked on.
No, that is just only on the screws.
Exactly.
Okay. Now you need to talk about the operating room cost. You need to talk about the surgeon cost. You need to talk about the anesthesiologist cost. So that procedure that the screw is $50. Now just only in the instrumentation, you're spending probably $20,000, $25,000.
Right.
My final take is that the self-representatives really don't have space in the OR. They are negative in the sense that they're going to push instrumentation that unnecessarily. They are negative in the fact that they can contaminate the field because they are not trained in sterility. They are negative also in the fact that the hospital and the doctor is totally depending on that group that is going to be pushing instrumentation to them.
So basically what you're saying is sales reps should meet you in the office and not necessarily the OR. Thank you for watching American Medicine Today. We'll see you again next week.